the Aloha Morning Show. Good morning, Dr. Jonathan.
Hey, good morning, Shane.
Hey,
Aloha. Thanks for having me.
Yes, thanks for your time and calling in. Doctor, what exactly does an orthopedic sports medicine surgeon do, and how is your role different from other orthopedic specialists?
Yeah, that's a really good question. So as an orthopedic sports medicine surgeon, I mainly focus on diagnosing, treating, and preventing injuries related to sports and physical activity. This covers everything from ligament tears, tendon injuries, to fractures and other joint issues. While all orthopedic specialists, they work with bones, joints, and muscles, my expertise is really about understanding the unique challenges that athletes face and how I can help them and continue with an active lifestyle. I work with a wide variety of patients, really ranging from all the way up to professional athletes to the weekend warriors, as well as, of course, our student athletes with school starting up again, and those who are simply active, helping them bounce back from injuries and get them back to their sport or active life as safely and quickly as possible. Some of the unique services that I provide again, are also more unique to their needs, including minimally invasive arthroscopic surgeries, as well as an emerging field in medicine that we call orthobiologics. And this includes platelet-rich plasma, or PRP. So PRP is a medical treatment that uses a patient's own blood to help heal and repair injuries. It has been shown to stimulate the body to grow new healthy cells and also promote healing faster than normal. This is something that we do right in our office at the Maui Memorial Outpatient Clinic. It's a really complex and emerging field in orthopedics, but if anyone wants to learn more, then you can feel free to give us a call at 808-442-5700.
Doctor, it is always important to warm up before you start, exercising, and injury prevention, of course, is always at the forefront. How important is it to warm up and cool down for injury prevention, and what should these routines include?
Of course, yeah. So warming up and cooling down are super important if you want to avoid injuries. A good warm-up, of course, gets your muscles, joints, and heart ready for action. It boosts your blood flow, raises your body temperature, loosens up your muscles, all of which help to prevent strains and sprains. Solid warm-up program should last anywhere from about 10 to 15 minutes, including light jogging, some dynamic stretching, movements that really mimic what you're about to do in your workout or your game. And then on the flip side, cooling down is just as key. So helping your heart rate come back down gradually, preventing muscle stiffness, all of that really helps with recovery. A good cool down should include something like a light walk, followed by some static stretching, holding each stretch for about 20 to 30 seconds. So again, warming up gets ready to go, cooling down helps you to recover, and skipping these can really increase your risk of injury. So it's really worthwhile to make them part of your routine. Yeah,
part of the workout. And finally, Doctor, what are the risks of getting back into sports too soon after an injury? Now we're getting back into MIL sports, seasons, and how do you guide your patients when it comes to that?
Absolutely, yeah. So it's a really important balance to understand. So, of course, we want to get our patients and our athletes back on the field or in the water as soon as possible, but not at the risk of re-injury. Jumping back into sports too soon after an injury can definitely be risky. The biggest issue is that you might get hurt again, and this time it could be even worse than the first time. Your muscles, tendons, and ligaments haven't fully healed. They're much more likely to tear or strain again, which could lead to even longer recovery or sometimes even permanent damage. I always tell my patients, do it right or do it twice. And what I mean by that is, it's important to be patient and to stick to your rehab plan to give you the best chance at full recovery and avoiding re-injury. I work with them to keep track of their progress and make sure that they're really ready to get back out there. Some of this testing might include strength testing, checking their flexibility, sometimes doing sport-specific drills to see if the body is ready to handle it. And I always encourage my patients to listen to their bodies and not rush things. It's always better to take a little bit of extra time to fully heal than it is to risk getting sidelined for even longer with another injury. And so with all that, it's important that we have a plan to keep and get our patients back to activity as soon as possible, but also, of course, as safely as possible.
Well, Dr. Jonathan, thank you for calling us this morning. Some great information in this one particular subject. Thanks for calling us. We'll talk again, buddy.
Of course.